I want to hit a very brief story today on Medicare fraud because it ties into what I want to talk about from the Democrat debate last night and from Elizabeth Warren's health care plan. In Medicaid, I'm sorry, I think I said Medicare a moment ago, Medicaid. In Medicaid, in this last year, we had a 75B as in boy billion, $75 billion cost of improper payments from the Medicaid program. I want you to let that number sink in. I mean, sometimes I feel like we hear all these big numbers out of Washington and programs cost millions and billions and trillions and all, it's just numbers. The Medicaid program expanded greatly under the Obama era because he was pushing states to expand Medicaid. It was part of the Obamacare deal, expand Medicaid. So pushing states to expand Medicaid, which has translated into expanding fraud and corruption. And so here are the quick details of that. There's a big Wall Street Journal article about it, but there was $75 billion of improper payments made by the Medicaid program, which accounts for 20% of the total program tab. It's more money than we spend on the entire food stamps, or now they call it SNAP program. Fraud alone costs America, in the Medicaid program, costs America more than the entire food stamp program. And the point is, when we get involved in expanding government, and we're pushing, the left is forever pushing the growth of government, the control and power of government, we think it's going to be somehow just, government involved. But what happened is, unfortunately, when we have Medicaid, it's not just really public programs. We think of them as public, but they actually involve private players, private providers, private hospitals. And so one writer is calling it our system of venture socialism. He's saying even being worse than single payer because it combines socialism, which is, government gathers all the money and redistributes it in various programs, with some of the motives of capitalism, because government shields the private entities from market forces. Bottom line is we expanded Medicaid. We have massive increase in Medicaid fraud. 20% of Medicaid spending went to fraudulent payments. And this is the case when any government program grows, because unlike a private employer or private entity where the only money you have is money you earn, you bring in because you earn it, and you watch your bottom line and you watch your expenditures, because at the end of the day, if you run out of money, no one's going to bail you out. Well, that's not true when you're involved in government programs, because the government keeps providing money. You're incentivized to provide services that cost money, that bring more money to you, because you're not even thinking, if you're a Medicaid provider, you're not even thinking about the bottom line. You're thinking about maximizing the care you can offer that will bring more money to you under the government programs. Now, I understand people providing Medicaid care often lament that they could be earning more in the private sector. True or not, Medicaid gets bilked, which is the American taxpayer getting bilked. So, a few other quick numbers out of this. I'm not going to go there. Is that all of the Obamacare, costs that people lamented that the Obamacare system increased costs so much. 84% of all the Obamacare costs, 84% of all coverage increases under Obamacare were from Medicaid. And remember, Medicaid was created to provide care to the poor, single women and children. It was not supposed to be a substitute for a private health care system, but it's grown and grown and grown, as programs always will, as long as the government funds and funds and funds, which they can only do if they tax and tax and tax and tax. It is the connect these dots argument. Connect these dots. If you're going to promise big programs like the left does, you're going to push Medicaid expansion. You're going to bring people in who otherwise might have found a way to provide for their own care through a variety of sources where you can seek care only as you need it, small insurance policies, local clinics, but instead people sign up for a program that's free, and then connect these dots. You entice people to sign up. The federal government's pushing people to sign up. So care providers are going to be paid less per patient, so they're going to want to have more visits, more ways to bilk the system each time. And so the costs go up to the country, and the government's going to keep on covering those costs. And then, because the government has to cover those costs, They raised your taxes. This may seem like Economics 101, but all this promising of free services, free care, all it really means is hardworking Americans are going to have their taxes raised in programs that never have sufficient accountability, and very few players in the programs have any incentive to provide that accountability.